सर 7 लोक जॉईन झालेत.
तुम्हाला कोणाचं बॅकग्राऊंड येत असेल फक्त त्याला म्यूट करून टाका. ठीक आहे. ठीक असं
रेकॉर्ड केलं, रेकॉर्डला लावलंय,
रेकॉर्डिंग चालू आहे.
रेकॉर्डला ठेव म्हणजे नंतर त्यांना बघता येतील असं. तुम्ही माझ्या आणि जेव्हा ना माझ्या मला दिसेल.
आणि तुम्हाला शेअर करायचं PPT.
ते करूनच टाकते.
तुम्ही
शेअर करून
शेअर करून ठेव. हा
अनटायटल
दोन्ही पीपीटी हे त्यांचे पण नंतर शेअर कर. Then will be glutathione.
आवाज आपल्याला कन्फर्म करा.
गुड
Hello, can you hear us?
Yes, sir.
Sorry?
Chat box मध्ये टाइप करा.
Am I audible, everyone?
Yes, ma'am. Yes, ma'am.
Good afternoon, everyone. Myself, Dr. Pratiksha.
Recording in progress.
Good afternoon, ma'am.
We are starting the intralesional injections topic first. So let's have an interaction section. Can anyone tell me, when we talk about intralesional injections, what comes to our mind first? Which drug comes to our mind? Hello? Hello, doctors.
एक आध घंटा हो तो
Local anesthesia, ma'am.
और चलो मैं जो भी देखता हूँ.
Can you please repeat, ma'am?
Anesthesia.
Intralesional injections.
Like corticosteroids, ma'am, I think.
Yes, corticosteroids. Kennicott, right?
Yeah, Keloid.
Today I am
Triamcinolone acetonide.
Chemotherapy agents.
Yeah. Now, in which conditions we use Kennicott injection?
Like keloids
Yes.
or any tumors. Hypertrophic.
Yes. Hypertrophic
Alopecia
cells.
areata.
Alopecia.
Alopecia areata, or you can use
Acne
cystic
cysts.
acne also.
Okay. Sarcoidosis. So today we
ma'am.
are going to talk about keloids and alopecia areata. Okay. So today what are we going to see is what are intralesional steroid therapy? What are the conditions we are going to treat with that injection? What are the procedure? How is the procedure? What are the side effects and what are the contraindications? Okay. So intralesional steroid is used in the treatment reduce excess scar tissue, that is a keloid or a hypertrophic scar, induce hair growth in alopecia areata. So what happens? What is the mechanism of action of a Kennicott? Anybody? How it reduces scar, how it induces hair growth. What happens when we give injection Kennicott?
That triamcinolone, it will dissolve that fibrous cells or
Okay, let me tell you. Kennicott binds to the glucocorticoid receptors on the cells. So that ultimately causes to reduce inflammation and reduce the collagen synthesis. So it works in keloid scars. And in this alopecia areata, what happens is, what are the cells? It is an autoimmune disorder. So the cells in the alopecia areata, the hair cells, get damaged due to the autoimmune disease. So what Kennicott does is it allows the hair to go into the anagen phase. Okay, so when the hair goes into the anagen phase, automatically the hair, it is a growth phase, right? So hair growth starts. So in this therapy, a steroid solution is injected directly into the affected area and reduce symptoms such as pain or itching. So which we use most commonly is triamcinolone acetonide or a Kennicott injection. So can you see the pictures of keloid? First picture is a keloid on the anterior wall of the chest. Second picture is of a keloid on a hand. And third is a keloid on a ear lobule. I am audible, right?
Yes, ma'am.
Okay. So let's see what is a keloid. How a patient will come to your OPD when you are in your clinic. A patient will appear to you as a 64-year-old female of fair complexion underwent mitral valve replacement. So any procedure the patient has gone, any injury to the skin, they will come to you. The procedure and post-operative recovery were uncomplicated. However, during the following year, a thick keloid scar formed over the incision site. So this type, one example I've given ki how patient will present to you. Okay. So I've attached a picture of the case which I've presented. So can you see on the anterior wall, mitral valve surgery has
Yes.
done and a scar is formed.
Yes, ma'am.
So keloid is defined as an abnormal scar that grows beyond the boundaries of the original site of skin injury due to overactive inflammatory response and fibroblast proliferation. So what happens is, if this is a keloid, here when the wound was getting healed, there was more of proliferation of the fibroblasts and collagen is formed in excess. Okay, so this is a body's tendency to form. So we have to keep in mind, if such patients are having keloidal tendency and they've come to you, you have to tell them कि you have to take care of yourself. You should not get hurt. You should not get any injury because your body has a tendency to have a keloid. And even you have to take care कि if you are doing any procedure to such patients, you have to take care that the body is having a tendency of having a keloid. Okay. So how the keloid will present clinical examination when you do, it will present as a firm rubbery nodules in the area of prior injury to the skin. Okay. So what are the common sites? I've just mentioned few, but injury can happen anywhere, keloid can happen anywhere. But these are the most common sites: ear lobes, shoulder, cheeks, and chest. So what are the treatments if a keloidal patient is to you? So first will be keloidal creams, ILS, that is intralesional injections, intralesional steroids, radiation, and surgical removal. Okay. So what is the next topic? That is alopecia areata. So can you see the picture of alopecia areata? Here I've given a picture of a hair patient, female patient, having alopecia areata in the uh, uh, hair region, one in the chin region, and again a male patient. Okay, so what happens, patient, how they will present to you? A 25-year-old man was getting his regular haircut when his barber pointed out several areas of hair loss. A diagnosis was placed based on the classic appearance of hair loss patches with exclamation mark hairs at the periphery. So when you're examining any patient with hair, so you have a dermoscope with you. So when you see with a dermoscope, what you will see, a typical mark, that is the exclamation mark, will be seen in the patients of alopecia areata. So I've pointed out here. Can you see the exclamation mark? Okay.
Yes, ma'am.
In alopecia, what is alopecia areata? What are the definition? What is it? It is an autoimmune disease in which body's immune system attacks the hair follicle. Like I previously told you, it is an autoimmune disease. The autoimmune body's immune system will attack the hair follicles, and it may present as a patchy loss, hair loss, or a complete loss of scalp hair, or sometimes eyebrows, eyelashes, facial hair, and body hair. They can present you in so many different pattern of hair loss. You have to identify what type of alopecia it is. So what are the different types of alopecia? Patchy alopecia, alopecia totalis, alopecia universalis, and diffuse alopecia areata. So what is patchy alopecia? And it is most commonly seen. So patchy alopecia is a type of alopecia, most common type of alopecia, in which coin-sized patches, like see this picture I have explained. Can you see this coin-sized patches? This type patient will present to you coin-sized patches of hair loss. And in alopecia totalis, there will be total hair loss of the entire scalp. In alopecia universalis, this patient you will see they were not having eyebrows, eyelashes, no body hair will be there. Hair loss across body, including entire body, face, eyebrows, eyelashes. And in diffuse alopecia is just thinning off, sudden thinning of hair across the scalp. Okay. These are the different types. So you have to identify the type of patient, what is it, and treat accordingly. Now, triamcinolone, that is injection, intralesional injection, how you will give to the patient. A patient has come to you, you have understood, I've told you the cases, how they can present to your clinic, what are the findings that you have to see in those patients, typical findings like exclamation mark, and now how you will give, what are the, you have prepared the patient for a procedure that we are going to give intralesional injection. You have to take a consent from the patient. Now, when you take a consent, then the patient is ready. Yes, ma'am. Excuse me. Did anyone ask anything? Can I continue?
Yes, ma'am.
Yeah, so we have prepared the injection we have prepared the part that is cleaning and draping should be done of the part whichever we have to do. Suppose it is a keloid. You will put a numbing spray or you will put a Prilox ointment before 10-15 minutes, 20 minutes before the procedure. Then cleaning draping will be done. You have to take 0.1 to 0.2 ml is injected. Now you have to take an insulin syringe. If you take 0.1 ml of injection triamcinolone, same quantity you have to take normal saline, distilled water. Okay, you can put it with normal saline or a local anesthetic. Local anesthetic when we have to use when the patient is having pain at the site. Okay, but normally you can use normal saline also. Same quantity you have to take, same proportion, 1:1. And total dose, whatever total dose we are using, it should not exceed more than 1 to 2 ml per dose. Next session will be after 4 weeks to 8 weeks, 4 to 8 weeks. That is 1 to 2 months. You can repeat the session, but you have to see the size of the keloid, how it is. So you have to see the tendency of the keloid, see that part of the alopecia areata, how big it is, and you can decide accordingly. Okay. So next is corticosteroid can be full strength. You can get 10 mg per ml or 40 mg per ml or diluted with normal saline or local anesthesia. So you can get a prepared preparation also diluted. But I prefer using separate. So you can accordingly you can use anesthesia or normal saline. It depends upon the doctor, depends upon the patient and the tendency how the patient can tolerate it. Okay. Now, what will happen when you have given this? What the patient might complain? I'm having pain at the site. There may be slight oozing may be seen. Infection can happen. Allergic reaction can happen. Atrophy, that is thinning of skin. Telangiectasia, pigment change. So what is this? Pain, that is the patient might complain of pricky pain sensation. Whatever insulin syringe you have pricked there, that site pain may be there. So you can give normal paracetamol or you can give icing. You can tell icing for the patient. Next is bleeding. Whatever site you have done, there might be small oozing of blood. So that can be controlled by pressure bleeding. Infection can happen at that site and I already always ask for the patient if they're having any comorbidities like diabetes or hypertension, because high diabetes patients are more tend to have infections. You can ask these comorbidities, but irrespective of these conditions, patient might have any infection, so you have to take care of that. If the patient is having infection, you can give them antibiotics and control that. Allergic reaction, always ask the patient if they are allergic to any drug. If they have never used triamcinolone, you can do a allergic hypersensitivity test. Next is atrophy of skin. If you are giving injection at the site, whatever the keloid it is, there might be a thinning of skin. But you have to, when the patient is coming to you, see the size of the keloid. Then you're giving sessions, 1, 2, 3, 4 sessions. Then every session you have to see, because thinning might not happen in first session. Obviously, keloid, it will regress very slowly. So you have to go on seeing the sessions, monitor the patient carefully, and then you have to understand where you have to wait. So they should not be atrophy. Next is telangiectasia. What is it? The minute small vessels at the site can be visible. You have to take care of that. And pigment change. It is mostly seen in dark patients. That hypopigmented patch can be seen at the site of the keloid or alopecia areata. So you have to take care of these side effects. Contraindications. Contraindications is a no, where you have to stop. You have to not do in such patients. Is eyelash should not be injected at the site of active skin infection. So a patient is presented to you with alopecia areata and they are having fungal infection also. So you have to not do in such patients. You have to wait there. It is contraindicated because that infection might aggravate. Next is known allergy to triamcinolone. If the patient is allergic, don't give. Third is diabetes patients. You cannot give because they also might land up into infection or no wound healing, or they may be infected wound may be there. Okay. Am I audible?
Yes, ma'am.
Yeah, I'm showing a video of a keloid patient. How do we inject? Next slide.
अच्छा
And last, it's a camera.
व्हिडिओ कुठे बनतो
इथंच आहे लास्ट खाली.
लिंक आहे का त्याची काय
नाही डायरेक्ट घेतलेलं आहे. मग नाही होणार का?
नाही म्हणजे प्ले कसा होणार मग?
ठीक आहे, मग नसेल होत तर मी पाठवून देईन त्यांना.
बरं, ठीक आहे. चालेल. नंतर लिंक शिवाय ओपन नाही होणार.
ठीक आहे, नसेल तरी मी पाठवून देईन.
हा
फक्त त्यांना विचारायचं की काय आता क्वेरीज आहेत का, कारण संपलंय.
हा व्हॉट्सअपला शेअर करून द्या. प्रायव्हेट काय क्वेरीज असेल तर मग त्याच्याबद्दल
We are not able to send the video. I'll send it on the WhatsApp. If anybody has any query regarding keloids or alopecia areata or any intralesional injection, you can ask.
हॅलो
Which
हा
to the
मॅम
next? Yes.
मॅम अनेस्थेटिक ड्रग कोणतं यूज करायचं म्हणजे प्रिलॉक्स प्रिलॉक्स
Lidocaine.
वापरू मॅम प्रिलॉक्स यूज कर सकते हैं ना
हो, प्रायलॉक्स यूज करू शकतो. नमिंग स्प्रे पण तुम्ही यू कॅन यूज.
अच्छा
हा
ओके
हा. एनी अदर?
मॅडम इंजेक्शन दिल्यावर ग्रोथ होऊ शकते साईज मध्ये वाढू शकते
किलॉइडचं का? आर यू आस्किंग
ग्रोथ
अबाउट
होऊ
किलॉइड?
शकते येस
नाही, ग्रोथ नाही होणार, रिग्रेशन होणार ना तिथे. किनोकॉटचं ऍक्शन ते आहे ना, इट बाइंड्स टू द सेल्स ऑन द ऑन द keloid and it will regress in size. It will stop the collagen synthesis and fibroblast proliferation.
नो पॉसिबिलिटी टू ग्रोथ
नाही, ग्रोथ तर नाही होणार, रिग्रेशनच होणार तिथे.
आणि मॅम एक क्वेश्चन आहे
हा
मॅम किलॉइड आणि एलोपेशिया एरियाटा म्हणजे
हा.
दोन्ही मध्ये आपण प्रायमरी सोलर आणि केनाकॉड दोन्ही पण यूज करू शकतो ना म्हणजे असं कसं यूज
किनोकॉट
करायचं दोन्ही
म्हणजे
करायचं
स्ट्रॅमसेल. किनोकॉट
अच्छा
म्हणजे
सेम
स्ट्रॅमसेल.
येस येस त्याचा ब्रँड नेम आहे का ते किनोकॉड
हा
ओके
हा
ओके
हा.
ओके सॉरी
नाही नाही, इट्स ओके. Can we switch to the next topic?
येस मॅम
हॅलो
Yes.
मॅम
Recording in
स्ट्रेंथ
progress.
काय वापरायची
Can you repeat, ma'am?
मॅम ॲलोपेशिया एरियाटामध्ये काय स्ट्रेंथ वापरायची 40 पर ml घ्यायची की कशी 10-5 स्ट्रेंथ असतात ना मॅम त्याच्यामध्ये वेगवेगळ्या किनोकॉटच्या
हा मॅम, 5 mg per ml घेऊ शकतो आपण एलोपेशिया मध्ये.
आणि किलॉइड मध्ये
मॅम, नॉर्मल स्कार असेल, नॉर्मल थिकनेस तर 10 mg घेऊ शकतो, पण थिक किलॉइड असेल तर 40 mg घ्यायचं.
ओके मॅम.
आपण ते पाठवलेलं आहे ग्रुपमध्ये, पाहिजे तर मी परत पाठवते डोसेस.
ओके मॅम.
येस, थँक्यू.
तुमचं
नेक्स्ट होतं ना.
हे जे अच्छा
हा, ते
ठीक आहे. तुमचं PPT घ्यायचं, ठीक आहे. अजून काही नाही त्याच्यात.
थोडं सांगा त्याच्याबद्दल मी दोन पटकन मी बोलतो Am I audible, visible? Please type in chat box.
Yes, sir.
Yes, alopecia areata, it is an autoimmune disorder. What to do? I am giving revising the I am revising alopecia areata. Alopecia areata is an autoimmune disorder, just like अपना ये जो रहता है psoriasis is autoimmune disorder of keratinocyte. Vitiligo is a disorder of autoimmune disorder of melanocyte. मिस्थेनिया ग्रेविस जो अमिताभ बच्चन साहब को है, उनका लेफ्ट शोल्डर को वो ऐसा है, देखो कभी भी वो autoimmune disorder of muscle, that is called myasthenia gravis. यानी कि antigens are formed against antibodies. That is called autoimmune disorder. The main what are the uses of called triamcinolone? They come in 10 mg and 40 mg. You have to mix with NS, and other you can mix with lignocaine, but don't mix with normal distilled water because it is anisotonic. And second way thing is alopecia areata. What is the dose? You can go from scalp, for the scalp. You can go from 5 mg to 10 mg. Insulin syringe take same units of called triamcinolone, and you can take normal saline or lignocaine, and you have to give at ILS at the 30 angle, 15 to 45 angle वैसे बुक्स में लिखा है 15 एंगल है ILS, मगर it is not applicable at practical. You have to give at you can give at 45 angle for scalp, and for alopecia barbi यानी कि दाढ़ी के लिए ये जो है alopecia, उसके लिए you can give 5 mg of Kenacort. And for this one, you don't give generally ILS. You can give topical tacrolimus, clobetasol.
नहीं है बंद।
Kindly mute. You can give clonate, clobetasol, tacrolimus, multivitamins, and you can add bimatopost eye drops for massage. That is for alopecia areata. And for keloid, 10 mg to 40 mg you can give same procedure. You can give 45 angles. केलॉइड कहाँ का भी रहने दो, मिनिमम डोज छोटा रहेगा, मिनिमम केलॉइड रहेगा तो 10 दे दो, मीडियम रहेगा तो 20 दे दो, और ज़्यादा रहेगा तो 40 mg तक दे दो, ज़्यादा ओवर मत दे दो 60 80. एंड यू हैव टू कॉल पेशेंट पर मंथ for every month for 3 months, 3 or 4 months regularly. Then visible results will be seen. Same for alopecia areata and for keloid. Keloid क्यों देते हैं? It is anti-inflammatory. Trachenacoid is a glucocorticoid. It is a steroid. It can causes atrophy. But if you give more doses, then it can cause स्काल्प थिनिंग, मोर एट्रोपी. अभी समझो एक पेशेंट आया मेरे इधर, उसका ये हो गया, समझो उसको केलॉइड है, मैंने 3 डोज दिए, 4 डोज दिए केलॉइड, उसका केलॉइड गया. तो अगर 1 साल बाद अगर वो फिर से आया और वो बोला कि सर यहाँ मेरे इधर खुजली होने लगा है, तो अपने भी दिमाग में आना चाहिए इट इज द सिंबल दैट केलॉइड इज गोइंग टू स्टार्ट. Then you have to put him on oral steroids. यानी कि you can give omnacortil, prednisolone 40 mg BD, देन टेपर करने का. जैसे स्टेरॉइड अपन मॉर्निंग में उठते 6 बजे ज़्यादा रहते हैं, एट द 6 PM वी हैव full of steroids due to HP excess. After that HP excess at in the इवनिंग अपना स्टेरॉइड लेवल कम हो जाता है. कभी भी देखो TDS दिखा जाता है सुबह, दोपहर, मॉर्निंग, सुबह, मॉर्निंग एंड नाइट में, फिर होता है सुबह एंड दोपहर में, नाइट में स्किप करने का, फिर सुबह, फिर ऐसा अल्टरनेट डे करके टेपर करने का. दिस इज द स्टेरॉइड ओरल टेपरिंग लेवल ऑफ ट्रीटमेंट, क्योंकि स्टेरॉइड डायबिटीज पेशेंट बहुत आते हैं, तो ओरल स्टेरॉइड टेपर करने का. रिगार्डिंग alopecia areata also, and regarding if you are giving for keloid also. And topical you can give, apply clobetasol lotion, clobetasol cream, etc. This is the in shortcut way. Now, Poonam Tupe Bandal is going to taking lecture of glutathione and multiple drips. Then I will conduct lipolytic. Okay. I am audible na right now?
Yes.
Yes, sir.
ओके,
Yes,
चैट
sir.
बॉक्स में लिखा तो भी चलेगा। और कोई क्वेरी रहेगी तो पूछो, कोई बात नहीं, बाद में पूछो सेशन के बाद में, ठीक है?
Yes, sir. Audible.
ओके,
Okay.
नाउ आई एम गिविंग टू पूनम। ओके, बोलो तुम।
Hello, doctors. Good afternoon. Myself, Dr. Poonam Tupe Bandal. We are going to study about IV fluids, different kind of IV fluids. Okay. First of all, we need to see why we are giving IV fluids.
Ma'am, you are not visible.
I am not what? Audible.
Visible, ma'am.
Visible. Okay. Now, am I?
No, ma'am.
No, ma'am.
Just give me a minute. Now, am I visible?